Hello, everyone, and welcome to this month's System of Care Expansion Leadership Learning Community. This is Denise Solzbach from the TA Network, and this month's learning community is on maximizing youth and family leadership in systems of care. And we have Jane Walker and Melissa Pearson from FRELDA joining us, as well as Johanna Bergen and Kristen Thorpe from Youth Move National. In case this is the first time you've joined us, this is Denise Solzbach. As I said before, I am the Deputy Director of the TA Network. Myself, along with Beth Struhl, host this learning community for System of Care leaders. Our goal is to help you not only work on your expansion efforts across your communities, states, and tribes, but also help make sure that you meet your grant objectives. And we tend to address topics and areas of importance to leaders. This is an interactive learning community. We encourage you to use the chat box throughout the presentation. We will answer, Beth and I monitor the chat box and answer questions as we go along. We'll also save any questions that you have for the presenters, and we'll address that at the end of the webinar discussion. The next webinar is not going to be until April 19th. That one is going to be on financing plans. Your financing plans are due at the end of year 2 of your cooperative agreement, and Sheila Pires will be joining us in April. We're not going to meet in March due to the annual research conference in Tampa, and we hope to see some of you there. The webinar learning objectives for today is to provide an understanding of family and youth leadership as a system of care value and as your funding opportunity announcement requirement. We look to provide some examples of family and youth roles for you, as well as review strategies for maximizing family and youth leadership. We'll have an opportunity to talk about, discuss, and identify challenges and solutions in engaging family and youth, and we also want to highlight some system of care examples from other communities for you. The 2015 and 2016 FOA requirements do require integral involvement and that you actually support families and youth in planning, governance, implementation, evaluation, oversight of your system of care and your expansion efforts. There are required positions to have a lead family contact as well as a task lead for youth engagement. And they're looking for you to show through your expansion efforts mechanisms to promote and sustain youth and family participation. We're also looking for family and youth involvement in their own services. They're looking for family-driven and youth-guided and directed framework and showing that family and youth are partners in their own treatment plans. They're also looking for workforce participation and expansion of peer support providers. And in this case, SAMHSA is talking about both family and youth peer support providers. And finally, they're looking for coordination with the statewide family network grants. And with that and the overview of the funding opportunity announcement requirements, I'm going to hand it over to Johanna Bergen, who's going to start us off with maximizing youth leadership.
Excellent. Thanks so much, Denise. My name is Johanna Bergen, and I serve as the Executive Director of Youth Move National and have over 8 years of experience in system of care youth engagement efforts, and I'm excited to talk to you all today. What will be helpful for us is to know a little bit more about who's on the call today. So we're actually going to start our section off with a brief polling question. We ask you to respond to the following question. My role can best be described as, and then pick the, from the identified options, the best fit for your role. And if your role is not included on this list, go ahead and hit other, and then it would be helpful to let us know what your role is in the chat box. And we'll give everyone just a few more seconds to respond to that. It's looking like we have a broad array of roles, which is exciting for our topic today. And for those of you that are marking other, go ahead and let us know your name and your role. Perfect. Thank you. All right, and it looks like the numbers have stopped moving, Gary, so we can close that poll. Thank you. All right, so today, on today's webinar, I'm going to be talking about setting an overview for youth engagement and youth leadership, and then Kristen and I will be going back and forth helping you really think about how to maximize and push forward the work of youth voice within your community. Youth Move National is a core partner in the Technical Assistance Network, and our team is available to provide technical assistance and training to your communities, and we welcome outreach and questions from you. In our role as a chapter membership organization and as a partner of the TA Network, we understand the importance of youth voice in developing responsive services and systems for young adults who struggle with behavioral health challenges. We work to provide strategic leadership around youth involvement and youth engagement at the national level, often mirroring the work of youth leaders and advocates within communities like yours. And Youth Move offers training and technical assistance in many areas that fit within the youth engagement umbrella, which includes leadership, sustainability issues, social marketing, and evaluation. So we're hoping that today isn't the first and only time we get to engage with you. One of the core values of System of Care is to be youth-guided. And what we mean by that is that young people have the right to be empowered, educated, and given a decision-making role in the care of their own lives, as well as the policies and procedures for all youth in the community, state, and nation. And so what does this mean? What does this look like? Youth-guided means that youth are empowered in their treatment planning process from the beginning and have a voice in decision-making. And so here we can think about youth voice at the individual level and helping each young person within our community develop the skills and ability to be a self-advocate and to guide their own plans, both within treatment settings as well as within their broader life. We mean that youth are engaged as equal parts in creating systems change at the individual, community, state, and national levels. This means young people appear at decision-making tables. They help us guide and develop policies and practices that make real-world sense to youth and families, and that they are valued as experts, and their voice and their lived experience is seen with equal expertise to other professionals and roles around the table. Youth-guided means that youth receive training. We should not make assumptions that simply creating space at a table and inviting a young person to join us in our work means that we can become youth-guided. There is an investment in time, resources, and training that we make with the young people who join us in this work. And youth-guided also means that equal partnership is valued. And we'll talk about that throughout today's webinar, but we really want to challenge you in doing more than creating space for youth voice. It really is through all of our actions, through the way that we budget our time and resources. Each of these are ways to show that we value
Mute off.
youth voice. I'm going to ask you another quick polling question here. And this helps guide how Kristen and I will continue to share examples throughout this call. So if we think about a short list of areas that we do work in youth engagement, I'm wondering which is most challenging for you. And the responses are youth empowerment in treatment settings, engaging youth as equal partners in our system of care governance structure, providing youth training to fully engage youth in our system of care work, youth-adult partnerships, or creating a culture which values and accepts youth voice. And we'll give you just a moment to dial in your options there. Again, picking the selection that you're most challenged by right now. All right, and we're seeing a variety of responses here, but several of you settling into engaging youth as equal partners in our system of care governance structure. And hopefully over the next few minutes, we'll give you some ideas and examples of how that might work and how we can promote that. Thanks, guys, for being active participants here with me today. So we use several words when we talk about youth engagement and youth involvement, and I'm going to run through just a few of them right now. And so you'll see within our work, and you may be familiar with these, we'll use words like youth-guided, youth-directed, youth-driven. And the reason we use different words is not that because we can't decide what word is best, but because youth involvement is a spectrum. And as we think about engaging young adults along those levels of individual, community, state, and national, we may find ourselves in different locations between youth-guided, youth-directed, and youth-driven. And as a community leader within system of care, you may find yourself throughout your work working with young people where young people are really driving the process in one area, and in the same moment, young people guiding a process somewhere else. So when I use these words, youth-guided means that youth and adults are aware and engaged as they explore the ideas and skills of youth leadership and begin to value youth experience as integral to the decision-making process. And I really key in for youth-guided around that word explore. So this is oftentimes input is being given on the behalf of, on the side of youth and young adults, and that guidance and idea is being listened to by supportive adults and allies in this work. As we move to youth-directed, youth begin to make recommendations and fill steady, meaningful roles in decision-making bodies. Youth and adults collaborate to guide and prioritize goals and develop strategies for positive change. And here you see the meaningful involvement deepen for young adults. And there's oftentimes still many important components of guidance, but that guidance and that voice can be heard at our leadership and governance tables, for example. And when we use youth-driven, we mean youth have self-awareness and the skills to initiate change, as well as the intrinsic motivation and sense of purpose necessary to follow through. Youth have mutually respected relationships with adults and other youth in the community as they partner for the change desired by youth. And here you see, and here not only young people as the drivers of the change, which is the potential that all young people have to really drive change, they don't do that in a vacuum. So in youth-driven practice, we have those mutual partnerships that allow us to work together to create that commonly defined change we're working towards. And if there's one thing you can take away from our time today, is that no one community, one system of care will be youth-driven 100% of the time. We're going to be moving around this spectrum, and young people are going to take us around this spectrum as they are given the opportunity to choose their roles as advisors, as facilitators, as leaders. And for those of you like me that enjoy a bit of a visualization of what we mean by this, I appreciate this slide that shows the interconnected gears of youth-guided, directed, and youth-driven. And I encourage you to think about when you create strategic plans for engaging youth and young adults, that you consider specifically involving young people in individual self-advocacy treatment settings, as well as within any organization as a partner within your system of care. Where is the youth voice within that organization? And then in leadership within your system of care, where is the engagement of youth and young adults? It can be helpful to have a tool to do a bit of self-assessment, and we use this as a readiness tool. So on the slide today, here you're seeing Hart's Ladder of Youth Involvement, and this is a tool that we use within our chapter network and with youth-run programs to help us think about where we are today and where we want to go. So the lower rungs of this ladder are at manipulation, decoration, tokenism, where we may have young people at the table, but their voice really isn't heard. You'll hear the phrase, youth have been invited, so we can check off the youth-guided box on our to-do list, right? And that's not what we mean by youth-guided, especially involving young people in the systems change that we're all about. So as you work your way up the rungs of the ladder, you'll see language that helps you think about youth in youth-guided roles, directed, and driven roles. So the middle rungs of those ladders are about young people providing input, being used as consultants, advisors. As we move up the ladder, there may be adult-initiated and adult-planned events and activities, but young people are able to input their guidance and their suggestions and may make some decision-making roles. As we move to the top rungs of the ladder, that partnership is really switching, and there's room for young people to initiate, guide, and direct the plans, and adults are there to help and support that process. And so we ask, in a planning session, we ask young people to rate where they are in their youth group or youth program on this ladder, and then we also ask them to think about where their community at large is, because oftentimes there's important work we need to do in changing the culture of how we view young adults and how we come to a common shared value that their voices are important and hold expertise. Youth engagement within system of care contexts can look like so many things. So the potential is really endless. So young people are working within system of care grantees as meeting facilitators, as event planners. They're working as data collection and helping design research and evaluation that shows the positive outcome of our work. Young adults are serving as communicators, as connectors with their peers, doing outreach and recruitment, education within the communities. When people ask us, what does youth engagement look like? What does a Youth Move chapter look like? That's not an easy question, nor really a question I want to answer, because young people need to be given the space to design what they need most in their community. And that means that youth engagement is going to look unique to the needs of your community. We do work with our chapters to capture, instead of what they do, why they do it. And so we work with youth programs that exist for a variety of reasons. Some of them primarily focus on personal skill development of the youth leader themselves. Others really focus on developing youth advocates and leaders to work within the system. Other chapters focus on education to the community, awareness raising, stigma busting that supports a positive community experience for young adults who have systems experience. And then we have chapters and youth programs who are offering peer support in informal group settings as well as formalized peer support. And youth engagement looks like all of that. So there really is a multitude of opportunities for you as you're engaging and designing your youth engagement plans. I really think that if we can remind ourselves and carry the light that young people are, in each of our communities, are amazing and infinitely hopeful, and we really view them as a deep resource of untapped potential, we can create plans that are going to help us make change in a far more effective way. And I'm going to pass it over to my colleague at Youth Move, Kristen, to talk to you a little bit more about that.
So thank you, Johanna. So hi, everyone. My name is Kristen, and I am a Youth Program Specialist at Youth Move National in the Office of Technical Assistance and Evaluation. Oh, I think we both moved a slide forward. Okay. So as Johanna was saying, engaging youth not only generates useful knowledge for your community, but it also provides the opportunity to facilitate positive youth development and empowerment. Some foundational research in the field of positive youth development identifies three major factors that foster resiliency, including caring relationships, having high expectations, and then opportunities for young people to contribute. This leads to a mutually beneficial relationship for young people, organizations and systems, and then the broader community as well. Partnerships between system of care leaders and youth promotes youth development and the improvement of services that directly affect young people's lives. Youth are directly impacted by the services and supports offered by system of care, yet youth's knowledge and understanding of issues are often undervalued or overlooked or even at times dismissed. But they can really help to improve service delivery. As important stakeholders in programs, youth can provide valuable input on designing youth-friendly services or help to identify gaps that might be existing in the service array. And youth bring a level of clarity that we often overlook. Are we asking the right questions? Are we using language that young people understand? Are we providing services and environments that feel safe for young people? And youth also bring ideas that can help us to improve our efforts and the way that we do business. So obviously, we all know that it can be challenging at times to successfully engage youth. And from a professional's perspective, there are often time constraints, maybe some concerns over youth knowledge and lack of also direct access to youth, which can be, as I said, a barrier to engaging youth successfully. And good youth engagement takes time. Not only does it take time to recruit interested young people, but also the system of care leadership must establish trust among all participants and take time to adequately train young people to understand, and staff to understand how the youth engagement process works, as well as for young people to understand system of care, what it is, what the values are, what the philosophies behind it is. And then again, it can be challenging to recruit youth if you're not directly partnering with youth programs or organizations. Good youth engagement, as I said, takes time. So in order for youth to successfully contribute, they need to be trained, mentored, and coached. Youth will be unable to participate in system of care activities if they are unfamiliar with system of care principles or the way bureaucracies work, for example. Youth must be trained in meeting etiquette, strategic sharing, and other skills such as facilitation or public speaking. And this all requires time and effort by system of care leadership. System of care leadership and other agency staff also need to undergo training on youth engagement strategies and youth culture. It's critical that organizations are prepared in advance and have made a commitment to changing institutional cultures and practices in order to lay the foundation for incorporating youth voice. Adult partners are often concerned that youth will lack the capacity or content knowledge necessary to contribute to systems change work. Most of us are busy, and the temptation might be to do business as usual. And after all, we know the work, and we feel we can move it forward more quickly. However, the benefits I previously outlined should really remain at the forefront of our thinking. Youth voice matters, and it's ultimately going to improve your system of care work. And then lastly, as I said, it can be challenging to recruit and retain youth. It's especially challenging if leadership is removed from the direct service array. And a great strategy for this can be partnering with existing youth programs or organizations that you can tap into. From the youth perspective, there are other challenges that you might have to overcome. Most youth are enrolled in school or work full-time jobs, and often they are balancing both commitments. This can be a huge barrier to participation, as most meetings are scheduled during regular business hours, limiting the pool of young adults who might be able or willing to engage in system of care efforts. Many youth are experiencing really demanding schedules, and if they don't see the value added of participating in system of care activities, they're going to prioritize other interests or responsibilities. For example, youth often have family responsibilities. In some cases, youth might be caring for younger siblings. In other cases, they may even have a child of their own. And finding and paying for child care to participate in extracurricular activities such as a system of care committee or work group can be an incredible burden and barrier to engagement. Transportation is another frequently cited challenge for participation. Many young people lack access to a vehicle or public transportation, and this is especially challenging for rural areas. And finally, youth may not find participation in system of care activities meaningful or engaging. Oftentimes, meetings aren't conducive to including youth or family members, and professionals have a tendency to use acronyms and jargon that don't necessarily invite or encourage youth to feel comfortable sharing. We're all guilty of it, myself included. So feeling unprepared to contribute can also be intimidating. And that said, there are lots of strategies for addressing the concerns of both adult partners and youth and young adults. So when possible, it's really great to provide incentive for participation. Incentives can range from financial support or gift cards to school or volunteer credit, or even providing snacks or a meal. Incentives not only encourage retention of young people in the long term, but it also honors the time that they are investing. Professionals are paid to sit at the table, so we shouldn't necessarily expect youth or family members to volunteer their time. And many youth are struggling to balance their lives, especially those who are experiencing behavioral health challenges. So as professionals, it's really important for us to show that their participation is valuable. It's also critical to have a point person to support young people who are engaging in activities. Scheduling time to adequately prepare a young person to be able to meaningfully contribute is really essential. As we just discussed, youth will be unable to fully participate in the process if they aren't supported with preparation and time to debrief. Before inviting a youth to a meeting, for example, it's really important to provide context, education on agenda items, and review of acronyms or jargon that may come up throughout the meeting. And it's also helpful for professional members of the group to be mindful of language choices, or if you notice someone is using an acronym, just to pause and say, would you please say what SOC means, and have the group share and pause just to constantly remind people to be accessible. And partnering with youth programs or organizations can be a really great strategy for supporting youth. As a whole, youth programs and organizations will have existing infrastructure to support training and other logistics. And not only can they provide direct support to youth engaging in system of care efforts, they can also provide training to system of care leadership and other staff on the importance and value of youth voice. Additionally, partnering with youth organizations can be a great way of meeting other system of care goals, such as developing peer-to-peer programming or stigma reduction and mental health awareness activities. If able, adjusting meeting times to later in the afternoon or early evening when youth and young people are out of school and work. Providing logistical support around transportation is also helpful. If that's not possible because of organizational policy, make sure meetings are scheduled at an accessible location, such as on a bus line or within the local community where youth are at or already going. It's a really great way of ensuring that youth voice is at the table. It's also important to offer meaningful leadership opportunities. Youth must feel they have voice and choice and that their recommendations are taken seriously if they are to remain engaged. Build in activities or facilitate conversations that create space for youth voice and actively solicit youth feedback. Similarly, in order to have a true youth-adult partnership, youth must be given an equal voice during decision-making. If a young person's idea or recommendation isn't going to be incorporated or acted upon, follow up and just provide an explanation for why that's the case. Youth aren't always going to be able to get their way, and we understand that, but it's really helpful in order to keep engagement going that they understand the reasoning behind a decision. And now I'm going to turn it back over to Johanna to discuss the community example.
Excellent. Thanks, Kristen. I'm going to take just a couple of minutes to highlight some of your peers within the system of care world. Know that one of the ways we like to provide support around youth engagement is to do peer-to-peer learning between grantee communities who have some similarities in their youth engagement approach so that we can learn together. The examples that we'll be highlighting today, I'd like to key in on that these are communities that invested specific resources into individuals who were able to lead and champion their youth engagement work, and that these leaders were allowed, were given the space and allowed to have a primary focus of youth engagement, which allowed them, in a large part, to deepen the level of work that they did. Youth Move New Mexico is one of the chapters that I'll be highlighting here. Their original chapter leader was a System of Care Youth Coordinator position. This position was originally created with grant funds and became to be a very highly valued position within the community and within the state. And in a show of support and an embodiment of the value of youth voice, they included the creation of and sustainability of this position within their Children, Youth, and Families Department. So the youth coordinator position was able to maintain that role within the state. This systems level position is able to support youth engagement within the state government and also to provide an umbrella support for youth efforts across New Mexico communities. Now there are additional youth partners who work regionally in New Mexico's systems of care. Among many activities that they do each year, there is an annual youth summit that is designed by youth for youth, which provide an opportunity for youth to identify their own training needs and then to provide and access those training needs from their peers. Everything from building individual self-esteem to developing leadership skills to learning about issues important to the LGBTQ youth and their allies. Youth leaders determined their most pressing training needs, and the summit is a way to provide them this support. One key piece of Youth Move New Mexico's work surrounds the creation of a youth engagement training. This training is offered to foster parents, community partners, service providers, and is designed to guide adult partners in learning essential strategies and tools needed to effectively engage youth. The youth and young adults came up with this training based on their lived experience and the knowledge they've gained through additional training, and are serve both as trainers as well as active advocates in their community. It's structured as a youth-driven process and delivered by young people with lived experience to their adult partners. But the idea of a training like this helps set up the culture for youth engagement and creates environments where youth voice is more readily accepted. And it helps everyone understand and walk away with a common understanding of what youth-driven is, how to build trust, listen effectively, and to engage young people in long-term strategies.
So as previously mentioned, it's critical to provide training to staff on the process of youth engagement. And it's equally important to offer training on implicit bias or ageism. Caring and supportive adults are key to successfully involving youth. So it's important to provide training to staff who will be working directly with youth. And if staff have limited experience working with youth specifically as partners, it can be really challenging to shift perspectives about young people and their credibility. And then each youth will be at different leadership and engagement levels, depending on their personal motivation, time, and ability to take on tasks. It's really important to provide a range of roles depending on where youth are at. While some youth might be able to jump right in, others are going to require more intensive adult support early on and will then transition to take on greater leadership and independence as time goes on. And though it's really easy to rely on those superstar youth who show a really great level of leadership, it's really important to provide the opportunity for a diverse group of youth to participate in activities. And be mindful to select a diverse team that really reflects the community that you're working in. And things to consider are race, ethnicity, gender, socioeconomic status, and education background, and of course lived experience. It's also important to remember that the one young person sitting at the table doesn't really equate youth involvement. One youth cannot be the spokesperson for an entire youth population, so be mindful of creating a really robust team of youth that you can learn from and partner with. And youth culture is really unique and sometimes conflicts with adult values or professional environments. So use young people to train you and your staff on youth culture and know that it varies. Youth have vastly different experiences and worldviews, and lived experience is extremely valuable in understanding what's going to best meet the needs of your young adult population. Youth have lived experience they understand the issues that youth face. They understand community challenges and strengths and what services and supports are really essential to their well-being. And in order to sustain youth involvement, use youth voice for change. Youth often disengage if they don't feel that they're seeing results from their efforts. So a report that sits on a shelf isn't going to necessarily be a satisfying outcome for young people. But seeing actual changes, either through a program change or maybe the incorporation of youth feedback into a survey tool, that's going to go a long way in retaining youth and maintaining their motivation to staying engaged. And I'm going to hand it back over to Johanna for one more community example.
Thanks, Kristen. So a brief peek into Youth Move Miami, who serves as the youth leadership voice within the Miami-Dade system of care. Youth Move Miami's mission is to be equal partners in the systems of care transformation by using the perspectives of youth. And this is a particularly fun example because the youth leaders within Miami have chosen several different mediums to have their voices heard. So you can see a rich list of activities that they engage in on the slide in front of you, which includes executive leadership positions and advocacy roles throughout their systems of care, and the other sort of traditional peer connection services, recruitment, and engagement. Youth Move Miami also loves to communicate with their fellow peers in a variety of mediums, including dance and music. And I'll leave you as a parting piece of homework to check out some of their videos online as we think about some concrete examples of how youth culture and youth voice can infuse the work of our system of care. We're leaving you with a list of resources, and if you download the PowerPoints, those hyperlinks will be available for you to check out additional information. And we pointed you in the way of specific topics that should be of importance to you in your work as a system of care leader now, and will be available for questions throughout the webinar and in the future as well. I'm really excited to be able to pass you over to Jane and Melissa to dive into maximizing family leadership.
Thanks, Johanna. Hi, everyone. My name is Jane Walker, and I am the Executive Director of FRELDA. I can see in the chat box we have several family leaders on the call, so I want to give a shout out to them, thank them for being with us today. This webinar is really condensed. You can tell from the information already presented that there is so much to say. So we'll be brief, but know that the resources and the technical assistance for both Youth Move and FRELDA are available to you. So this collage of families really says it all for us. We family leaders, that is, do this work for our own families and for all children and families touched by behavioral health needs. It's our passion, and we care so much because the foundation of family-run organizations is lived experience. If you talk with families who've been through the system, 99% of them would say, I want to help other families so they don't have to go through what we went through. FRELDA stands for the Family-Run Executive Director Leadership Association. Now you know why it's just referred to as FRELDA. It's a long name. It's a national organization started in 2013 by a group of executive directors of family organizations with a mission of strengthening the leadership and organizational capacity of our organizations. It is a national network across the country. The family movement is not new, and the first federal funding for a state family organization was actually in 1988. And it was followed a year later with the founding of the National Federation of Families for Children's Mental Health in 88. All of this actually occurred before SAMHSA's Children's Mental Health Initiative, or as we now know it, System of Care, was first funded. So family organizations and Family Voice have been a foundation of systems of care from the start. And later we'll talk about the multiple roles they play in expanding and strengthening systems of care for children. FRELDA is proud to be a partner in the Technical Assistance Center for Children's Behavioral Health, as well as other TA centers. And our role is to provide technical assistance to you, states, local communities, and family-run organizations on building family leadership and engagement. As mentioned, family-driven care is a foundational value of system of care. It says the system of care should be child-centered, youth-guided, and family-driven, with the needs of the child or youth and family dictating the type and mixes of services provided. And one of the guiding principles of a system of care goes even further to say families and surrogate families should be full partners in all aspects of planning and delivery of service. Youth and family voice are not always the same. It's important to note that. But they're equally important. They don't always progress at the same speed, but there's indeed space needed for both youth and family voice. As a result of President Bush's New Freedom Commission way back, it seems like ages ago, the National Federation was charged with developing a definition of family-driven care that was finalized in 2008. And you can see the definition there. It emphasizes, of course, primary decision-making role in the care of their own child, but also policies and procedures governing care for all children. This definition clearly identifies multiple levels of family involvement, starting with an individual family all the way up to the policy and system level. The definition really includes also culturally and linguistically competent supports and services, families setting their own goals, families participating in design, implementation, and evaluation of programs, monitoring outcomes, and partnering in funding decisions. So if a system of care is truly family-driven, then families are involved in all levels, from policy to management to service delivery. Like Johanna mentioned and Kristen about the multiple roles that youth can serve, likewise families are sitting at policy tables, participating as part of RFP teams, responding to grants, involved in system design, serving on advisory boards. Families are part of quality improvement and evaluation. They're trainers, co-trainers, participating in the hiring process. And at the service level, of course, family members are on their own child's team, but rapidly growing numbers of family members are being employed and trained as parent peer support providers. This is becoming a valued segment of the behavioral health workforce, and in many states, parent peer support services are now a Medicaid reimbursable service. Getting to the point where you have families that are able to participate at all levels of the system is not easy, and it doesn't happen overnight. So hiring a lead family contact is a key to starting that engagement and building of leadership. A 3/4 to full-time family lead contact is a requirement of the System of Care Expansion and Sustainability Cooperative Agreement with SAMHSA, but it's also an opportunity to demonstrate a commitment to the value of a family-driven system of care. Filling this position with the right person is crucial. A critical qualification is lived experience. Also, the lead family contact should be part of the leadership or management team, and to do their job effectively, the lead family contact needs funding, a budget, and support from the highest level. They also need peer supervision in addition to administrative supervision. They really serve a dual role as a system partner to you and a liaison to the families. It's a tall order for anyone to fill. So let's pause for a minute and do a poll on how many of you on the call have a lead family contact in place for your award. Let's see who. Well, of the responses we have it looks like a few more people have a lead family contact in place, and I'm sure that the ones who have not responded or responded no are working on that right now. So, as noted, a key qualification is lived experience as a parent or primary caregiver for a child or youth with mental health needs. However, and I can't emphasize how important that is, but it's not sufficient. It's not the only criteria. Ensuring the family lead is representative of the community, and I think Kristen did a wonderful job of, identifying some of those characteristics in terms of race, ethnicity, and that are really important in looking at the right person for the lead family contact. But equally important is, where is that person on their journey? And are they in a place where they can actually reach out to families? And I touched on this before. We also believe this position really needs to be dedicated to family engagement, with another position dedicated to youth engagement. Some sites have tried to combine this, and it hasn't really been successful. And when you listen to the youth voice, you can really understand that there are distinct voices, and it's important that both are heard and both have space. So there are options for hiring a lead family contact. And if there is an existing family-run organization in the state, the System of Care site may contract with the family-run organization directly to designate a senior staff member to function as the lead family contact, or possibly hire a staff member for that position. And there are really multiple advantages to this arrangement. The family organization may have participated in planning the proposal and is already knowledgeable about the goals of the award. In addition, the family-run organization has access to families and may easily be able to identify and train families who can fill leadership positions, like participating on committees or in governance, or even becoming parent peer support providers. Another option is employing a lead family contact in local or state government if there is no existing family organization. Some sites may directly hire, and there are advantages to this as well, in that the lead family contact has close access to the project director and other key staff. However, this can sometimes be a lonely and challenging position if the lead family contact does not have the support or a means to connect directly with families. Sometimes there are numerous procedural obstacles in local or state government that can impede or prolong the hiring process. So some states have done temporary contracting with a family member to get them started sooner and to get around some of those obstacles that could be protracting the hiring process. And lastly, sometimes a System of Care site has a goal that includes establishing a family-run organization if there isn't one already. This takes time to write bylaws, form a board of directors, and incorporate the organization. And the System of Care site can play a critical role in incubating the family-run organization by first employing or contracting with a lead family member while the organization is being set up and the necessary papers filed and the organization is incorporated. Once that's all in place, the contract can then be transferred to the new organization. So another polling question, if you've already hired a lead family contact, how did you fill that position? Are you contracting with a family organization, hiring within local or state government, or with possibly a family member? Or are you planning to start a new organization in your site? Wow, it's split three ways here so far. Okay, that's really interesting. So there are options, and people are really exercising those options. So FRELDA has developed a tip sheet on hiring the lead family contact position. It includes tips on hiring, options for filling the position, and a template for a job description. And you can download this tip sheet at the end of the webinar. It's also available on FRELDA's website. And now it's my pleasure to turn this over to Melissa Pearson, who is a project coordinator with FRELDA.
Thank you, Jane. As Jane said, my name is Melissa Pearson, and I'm a project coordinator with FRELDA. And I am thrilled to be with you today to talk with you about maximizing family leadership. Over time, the approach to working with families has evolved, just as you heard about the evolution with youth-guided to youth-driven. From being professionally centered with the professional as the expert to family-focused, viewing families as helpers, then we moved to seeing families as allies or customers, and next viewing families as meaningful partners in the process and working collaboratively together. So as you can see on this chart, the differences between where we started, where professionals were the experts and families were seen as part of the problem, to our ideal of becoming family-driven, where we have meaningful partnerships, equal access to the decision-making, and professionals are really seen as bridging their expertise with that of the family member. When the concept of family-driven care first arose, it turned the system upside down by putting families in the lead and professionals in a more supportive role with families. However, as Youth Move mentioned, with youth-guided care, family involvement and family-driven care exists across a continuum, from family-focused to family-allied and ultimately family-driven. It does not mean families are the final decision makers. It means that families in partnership with providers and systems make decisions that are realistic and relevant to the individualized needs of each child and family. It means the family's voice is as important as anyone else's, and it means that the expertise the family has to offer is considered as equally as that of a psychiatrist or a therapist. Building partnerships with families is an interactive process that takes time. As with any new relationship, you can't rush the process. It is important to get to know families and understand their desires and challenges. In order to establish an authentic partnership, you need to have trust, shared power, equity, shared values and beliefs, and a commitment to problem solving. Often, new grantees have asked us where to find families or how to engage families. In response to this, FRELDA has created an infographic tip sheet with suggestions on how to do outreach to families. And that tip sheet you can see reflected on the slide in front of you. The tip sheet includes community events, such as setting up tables at community fairs or at the library, using social media such as setting up a Facebook page or developing an e-newsletter, developing social recreational activities such as holding back-to-school events or picnics, supports, as mentioned earlier, providing transportation and childcare to enable families to participate, and looking at diversity to ensure that families you engage represent the community being served, and developing materials in multiple languages. It also includes partnering, reaching out to schools, the faith-based community, police departments, and ethnic groups. Incentives, providing stipends or gift cards, school supplies, etc., to encourage the participation of families. Using promotion as a tool by posting flyers at places families frequently go to, such as laundromats, libraries, or pediatricians' offices. Demonstrating appreciation by acknowledging the contributions of families through special awards or pictures on Facebook. And celebrating successes, milestones, holidays, and any special day of the year that are important to families. The real impetus for this tip sheet was a learning community for family leaders held last year, and family leaders were asked to provide how to reach and engage families, and based on that, the tip sheet was born. Recognizing that every grantee may be at a different place in developing partnerships with families, we want to offer some strategies. Looks like we skipped a slide there, so I apologize for that. We want to offer some strategies to use. The first being engaging and involving families from the beginning. Ensure that family voice includes those with lived experience, as you've heard from our previous presenters, as well as families' representation from the population of focus. It is critical that you engage families that have been served by the systems involved in the system of care and that represent the communities that you are focused on. Recognize and acknowledge their expertise. Families have a great value to contribute. They need to know that you see their voice and their contributions as valuable. Orient everyone. One of the lessons learned from previous system of care grantees is that by orienting everyone, including youth and families, it's easier to engage, involve, and generate buy-in to the system of care work. Anticipate and address barriers. As I mentioned, and as our previous presenters mentioned, there can be many barriers to engaging and involving families and youth, and it's important to acknowledge those, anticipate those, and address those ahead of time so that it makes it easier for families and youth to come to the table. Allocate resources. Ensure that family-driven care is not an afterthought, that it is something that is supported financially from the beginning of your grants and thought about as something that needs to be sustained for the long haul. Build partnerships. Engage all your stakeholders to be part of the family-driven care transformation in your community. It is not just the identified system of care staff's responsibility, but everyone's responsibility to be family-driven in a system of care effort. By engaging and including your stakeholders, they develop ownership and are more likely to see the need for sustainability at the end of your grant cycle. And embed policies and procedures. To ensure all members of the planning team understand the importance of and the process of including families, it's important to embed policies and procedures that require family member participation and voice at all tables. Family-run organizations can be a valuable partner in your system of care efforts. Get back to the right slide here, apologize. Family-run organizations can be another valuable partner in your system of care efforts. Family-run organizations are nonprofit corporations, but they are unique for several reasons. The first being that at least 50% of the board of directors of a family-run organization must be made up of family members with lived experience that have raised or are currently raising children with behavioral health challenges. The second unique reason is that executive directors of a family-run organization are family members with lived experience themselves. And the third is that their staff are predominantly family members with lived experience as well. The benefits of including, I'm going to pause there. We're going to do a polling question. So we want to hear from you before we move on. Do you currently partner with a family-run organization in your state or community? So if you could make your selection yes or no, if a family-run organization is being partnered with in your system of care effort. Give folks just another second to respond. Okay. It looks like about 57% of you, or just a little over 50%, are partnering with a family-run organization. So that's really great to see. By connecting to an existing family-run organization, it brings many benefits. It's more than the voice of one or two family members on a committee, but it brings the voices and experience of many families with diverse experiences across all child-serving systems, particularly those who would not be able to make their voice heard otherwise because they're holding down two jobs or don't have child care to participate on committees. For this reason, a partnership with an existing family-run organization can be extremely beneficial to your overall system of care efforts. A family-run organization also brings leadership and an ability to groom new family members to serve at tables and to be involved in your system of care work. Family-run organizations can sometimes advocate for systems or policy changes that those within the systems cannot. Their collective voices help shape the system and the policies and practices within those systems. Lastly, family-run organizations provide direct services such as information and referral, systems navigation, and parent peer support. FRELDA did a survey in 2014 and found that family-run organizations provided 26 different types of services. Of course, not every organization provides all 26 types, but that is the range of services that a family-run organization can provide as you build your system of care. FRELDA partnered with the National Association of State Mental Health Program Directors about a year ago to jointly develop a paper on the roles of family-run organizations in systems of care. This paper includes examples from states and communities about how family organizations can support your efforts at the child and family level as well as the systems level. And this paper is available for download at the end of this presentation. But we want to take a minute to look at these different levels and how families and family-run organizations can play a role at each of these levels. First, we look at the child and family level. And they can serve from a family navigation perspective, meaning that family-run organizations can help families navigate the complex child-serving systems that they often find themselves in. They can also assist by providing parent peer support, where another family member with lived experience is paired up with a parent who is currently going through the service delivery experience to provide support, empowerment, education, training, and access and advocacy support. They can also be a source of support groups where families can come together, learn together, share experiences, and draw support. They can provide education programs or trainings for families to help them better understand the system of care, the child-serving systems they're involved with, to better understand how to support their child with their unique behavioral health needs, and many other topics. They can also be a resource for community outreach. As was mentioned before, family-run organizations naturally have access to a lot of families in the community through their efforts. And so it's very helpful to partner with family-run organizations as you're trying to identify family members to engage and include in your efforts. And as mentioned before, it's family members who have children in multiple systems. As many of you are probably aware, the system of care typically focuses on populations of children and families who are involved in more than one system. And typically, the family-run organizations are connected to those families. Now let's take a look at the system and policy level. Some of the roles family-run organizations can play at this level are in the policy development arena, and this can be by having helping to serve at policy development tables, as well as supporting family members to serve at those tables. Some family organizations, like our partner organization in Massachusetts, the Parent Professional Advocacy League, and Families Together in New York State, place an emphasis on systems-level activities and have become very involved in legislative advocacy by supporting family members to share their stories with legislators. Others serve on committees and work groups at a state level where they help review and revise policies and procedures for how services are delivered to families, how the state dollars will be allocated for services and supports, and even what is included in the state's Medicaid plan. Family-run organizations create a developmental space for youth-run organizations as well. We frequently see youth programs that are started by the family-run organization develop and evolve into freestanding youth-run organizations who are also involved in all of these system and policy level activities. Often families can bring the voices of families to legislators in a very powerful way. Now let's talk a little bit about, before we leave you, some ways that FRELDA can support your efforts. The Family-Run Executive Director Leadership Association, as Jane mentioned, is focused on strengthening the leadership and organizational capacity of family-run organizations. But we are also focused on family involvement, family-driven care, parent-professional partnerships, and family leadership development. As a partner within the National Technical Assistance Network, FRELDA is available to all system of care grantees around the country. Here is a short list of ways FRELDA can support you in your work. We can assist you if you are looking at starting a new family-run organization in the event there isn't one currently in existence. We can support your collaboration efforts with an existing family-run organization. We frequently work with communities as they explore development of parent peer support as part of their behavioral health workforce. We also do a lot of work with communities around leadership development for family members and helping communities look at what are some strategies for developing family leaders so that they can have family members at all levels within their system of care. We also developed a curricula that is available that can help support the board of directors of a family-run organization to better understand their role as a board member and how they can serve in that capacity effectively. And lastly, we also do work with communities around strategic planning, specifically related to how they will engage family members, how they will do outreach efforts, and how they will support families at all levels, as well as the sustainability component that we mentioned around how will a community ensure that family-driven care is maintained beyond the life of the grant. As you are all aware, the Expansion Sustainability Cooperative Agreements with SAMHSA is not a grant. It is intended to create systems change. It is about creating culture change. Sadly, far too often when the system of care cooperative agreement ends, so too does the family organization and or family involvement that has been generated. So there are many things to keep in mind as you move ahead with your system of care work, but we ask that you consider 3 areas related to the sustainability of family involvement, family leadership, and family-run organizations. The first being around resources and commitment to sustaining the movement. From the outset, it is important to build an infrastructure for family partnership that can be sustained. It requires resources and commitment at the highest level and beyond the system of care award. It is helpful to in some way put language into law or regulation about family and youth partnership to sustain the values, principles, and practices. Working with families with lived experience means understanding that there will be crisis, meaning calls from school to pick up their children, emergency meetings, nights at the emergency department, and possibly even calls from the police. It's all part of the package, and particularly if a family member is employed by local or state government, it is important to figure out how to accommodate those crises. In many ways, that is an argument for contracting with a family-run organization, as they have learned how to continue to do their work when staff are out for their children's needs. And lastly, training and support for families is critical. For some families, this could be their first job, or they need support and training to be successful. They also need encouragement and supervision. It is very intimidating walking into a room of people you don't know and being expected to voice your opinion. Many of the individuals around the room will be professionals who have the benefit of education, supervision, coaching, and training. If we expect family members to serve alongside professionals as equals, we must think about how we support them as equals. And lastly, on this slide, we're going to talk a little bit about the Family Acceptance Project meeting coming up. One of the pieces that FRELDA is in partnership with the National Technical Assistance Network and the Cultural and Linguistic Competency Hub of the TA Network, we have an upcoming training that's going to be held April 25th and 26th in Detroit, Michigan. And it is a core training of the family-based approach to wellness, prevention, and care for LGBTQ children, youth, and young adults. It's a 2-day training. The first day being dedicated to providers and family leaders, where they will learn from Dr. Caitlin Ryan from California, who will be speaking with them about this family-based approach to working with LGBTQ youth. And it's really around the identification of some practices that families can take in their responses to their LGBTQ youth that can really help improve outcomes for their child and youth and young adults. And the second day is a unique opportunity for family leaders and family-run organizations to come together. And we will be doing some specific planning around how family-run organizations and family leaders can integrate what they've learned on the first day into their work back in their communities and back in their family-run organizations. So there's a link on the screen. This training is open for registration now. So if this is something that you're a project director, you're a wraparound facilitator, you're a lead family contact, a family-run organization partner would be interested in, feel free to register for that training. We would love to have you join us for that. Jane, before I move on to the resources, do you want to add anything?
We are also having a learning community call next Thursday at 3 o'clock that we can send out a link for as well on understanding LGBTQ communities and youth. That is kind of like a overall before this two-day conference, which we would invite everybody to join that call next Thursday as well. We can post that information. Okay.
Okay. All right. And we will leave you with this list of resources of some documents. As Jane mentioned, the Lead Family Contact Tip Sheet. We also have the 10 tips for outreach to families that I mentioned, and as well as the paper that was done in partnership with NASHVID. All of those are available for download at the end of the presentation. And we also have our link to the FRELDA website on this slide. FRELDA has a fairly comprehensive resource bank on its website, so feel free to visit FRELDA's website if you would like more information about our organization or if you are looking for information on a variety of topics. So I will just want to thank you for taking time out from your very busy day to joining us this afternoon, and I'm going to hand it back over to Denise to facilitate the question and answer.
Great. Thank you, Melissa, and thank you, everybody, for your presentations. If you have questions for our presenters, you can put them in the chat box. And while we're waiting, I'm going to start us off with a couple questions. My first question is for Johanna and Kristen. I heard you use the term young person interchangeably with youth. Is there a preferred term, or are they interchangeable? Can you respond to that?
Sure, we're waiting to see who talks first. This is Johanna. So our most common language and the language that YouthMove uses in our formal publications are youth and young adults. And the language is chosen to show the continuum of development as young people age. So if you're a community who has a population of focus in the sort of 16 to 21 years of age, and you're really working on issues that affect young adults as they transition out of the children's behavioral health system, we would choose for that population to use young adult specifically. The broadest term is youth. We've also found, though, in just the way you use language and the way your conversation flows, that young people is sometimes a smoother option. So I think it's okay. You know, what we don't say is kids and kiddos, right? Youth and young adults is the preferred terminology, and it shows a level of respect and begins that conversation of valuing their roles of expertise at the table.
Thank you, Johanna. Kristen, did you have anything to add to that?
Well, I was going to say, I think Johanna pretty much covered it all, but I sometimes say young person or young people because it kind of captures a broad age range. A 20 or 19-year-old development and needs are very different from those of a 13-year-old, and I don't really feel comfortable calling a 20-year-old a youth anymore. And that's something that when I was working directly with young people, they were like, I'm not a youth. So sometimes I use the term young people because it kind of casts a really broad net and age range for people who are working with multiple, for a spectrum.
That's very helpful. And I actually noticed that both of you tended to use young people more than youth throughout your presentations. That's interesting and helpful. You also talked about Hart's Ladder and how you work with young people and looking at Hart's Ladder and evaluating where their organization is and where their community is. Is there an average that you see coming from the youth perspective on both organization and their communities?
So that's a really interesting question, Denise. It's a question that we use in the chapter application process when groups apply to affiliate with Youth Move National. So technically, that data exists somewhere in Dropbox that I can find for you. What I do know and what we reflect on more than our folks at 5 or 6 is that there is a disconnect where youth leaders will identify where they are in comparison to where their community is. And they almost always, hands down, their community is behind them. That one of the barriers in their work is that their community is putting them in places where they are tokenized, where they're really excited and ready and feel that they have the ability to be driving the process. And that identification can be helpful because it changes the most pressing work, right? So when that happens, then young people can switch to saying, oh, you know what, we need to do some education and awareness building. We need to be requesting some support for our partners in understanding youth-guided and youth-driven as much as what we're asking for what we need individually.
Great, thank you. Jane and Melissa, Tanya Rodriguez has a question here about how do you start an organization when you're starting from ground zero and there's nothing there? Do you have suggestions for Tanya?
Tanya, it's a tough question for, I would say, any location, but I know in Puerto Rico there's some unique issues. And so I would say starting with identifying leadership, key family leaders, is probably the most sound advice I could give. And once you get, 1, 2, or 3, that you can really get them, and they will need resources. So you can't identify family leaders and not provide the resources, meaning pay them salaries to be able to reach out to other families. That's how you begin to build the grassroots organizing, reaching out to families in the many ways that Melissa identified. And so you've got to have the resources and the commitment from, not just the system of care, but the department, the administration, that this is an important value. And so once you've got that support and you've got resources to be able to identify and hire, and ways to identify, I would be happy to have an offline conversation with you about how to pull in some of those leaders. It's often through holding events, and there's numerous ways. We've done focus groups, we've done, town hall meetings, and you begin to see people who begin to have that potential, and then you begin working with them. So it's not easy, but it really does work. It certainly worked for almost 30 years now across the country, but it absolutely has to have the resources and the you know, not just the approval, but the support from highest levels.
Great. Thank you, Jane. Jane or Melissa, do you want to follow up? Pam for Virginia has a question, follow up. How do you provide peer support for new family leaders if you do not have a family organization?
Right. Yeah, I guess I wanted to just add a couple thoughts to Jane's comments, which I think also feed into Pam's question. I think, as Jane mentioned, that support is critical at the highest level, and I think sometimes to generate that support, there's a need to do some training and do some education and really approach those leaders that need to support the idea of family-driven care and engaging and including families by really looking at helping the leadership see the value and the benefit that having family members at the table and involved at all levels brings to a community and to a system as well as a state. I think as you mentioned, this providing peer support for family leaders when you don't have a family-run organization, again, as Jane said, is a tricky issue. But I think some of how you do that is really connecting them in, if you don't have a family-run organization, giving them access to other family members in the community so that they're able to draw from that community perspective, linking them into opportunities that may exist and connecting them to folks who have similar roles in other system of care communities, connecting them to things like the learning communities that we offer through FRELDA that we do once a month, where family leaders are able to come together and learn about topics, connect with one another to develop peer relationships and really draw support from one another from a collegial standpoint. I think those can be really, really beneficial ways to provide some support, as well as identifying are there kind of family allies within a system partner? Are there people who really kind of get it and really believe in the value of family involvement and family-driven care, and having those be those folks who are providing the support to that person until you have an opportunity to grow up the leadership for a family-run organization. Jane, I don't know if you would offer any additional suggestions to that.
No, I think you covered it.
Great, thank you. Let's turn to Kristen or Johanna. Similar struggles have to be in place and faced by communities in starting youth organizations and youth peer support. Do you have suggestions?
Yeah, Jane, I was totally channeling you there for a moment when you started to respond to your question. The first word that came to mind was champions. And so, identifying, key potential young people that you can start nurturing and supporting to see if they're interested in this. And then, Melissa, you identify the other type of champion, who is going to be their support. So, we always recommend you need to have an individual within your staff team who is going to be that solid foundation and base to build relationships and really be there again and again for young people as we start to engage them. And so you want to have those in place, and I've identified those team members even as you start the recruitment process. But the other thing, besides just keeping your eyes open for those champions all the time, is some sort of community mapping, community assessment of what already exists. And we encourage you to look for two things. One is, where are young people already convening with opportunities for leadership or advocacy? This may be within a different system, so young people who are experienced and have been working within the child welfare system, or even leadership like a 4-H program or something outside of the system's involvement. And are they interested in learning more about your work? Can you connect with young people within those programs and help them see and identify where their passion points might connect with your system's transformation work? And then the other thing you're looking for across the community is, where do we serve young people? So where are young people already accessing services and support, informal or formal, and how do we take our engagement and recruitment efforts to the places young people are gathering?
That's great. Thank you, Johanna. And Kristen, did you have anything else to add?
Yeah, I mean, I'm going to just echo Johanna, like those are kind of the exact same talking points that I would have come up with is finding existing youth programs or advisory boards. So, you know, often mental health agencies will actually have their own youth advisory board, so that's a really great starting place. So even if it's not a youth-run organization that's independent, there are often existing advisory boards, as Johanna said, even within systems or even within little agencies. Focus groups are a really great strategy, especially if you're able to pay a stipend. People will definitely come out for stipends. And then tapping into youth who are, as Johanna said, receiving services or who have received services in the past are kind of the strategies that I used when I was a youth coordinator. I used to like just pound the pavement and go to the teen shelters, for example, to talk to young people and get them involved in programming. And as I said throughout the presentation, when you do that, you're going to find a spectrum of leadership of ability. So some youth are going to be further along in how engaged they're going to be able to be, but going to where youth are is always a great place to start.
That's very helpful. Jane mentioned the family leadership learning community, and we talked a lot about today support for system of care leadership and policymakers and providers, but what resources do you have for family and youth leaders once they've been identified by a community? Do you want to talk first, Youth Move, about what you have to support young leaders, and then Jane and Melissa, what you have to support family leaders?
Sure. So we also host a learning community like this one, specific for youth peer advocates and coordinators. We meet bi-monthly, and the topics are chosen by the young people who participate in calls. And so definitely offer that as an easy virtual resource. We do quite a bit of community connections, either to Youth Move chapters that are close to you or other youth programming that we're aware of in your community. And then when we have specific requests for that connection, especially in the beginning, and there may be youth leaders in your community who are looking for peer connections, we do a lot of peer-to-peer coaching calls. So we'll help connect a young person in New Mexico to a young person in Kansas so that they can learn and hear from their peers. And that can be as personalized and tailored as your questions and situation need.
Great, thank you. Jane or Melissa?
Yeah, I'll be brief. Wait, you mentioned the monthly learning community calls, which people are most welcome to do. I think the other thing is we get many requests around very specific things. We're struggling with trying to reach out to families, or is there a family organization in our state or whatever. So we can, as Johanna mentioned, connect people or provide resources. We get lots of requests for those things. Additionally, if somebody has hired a new family lead contact, we are happy to work with that person initially and coach them. We've done that in several states where we'll set up a monthly call with them, that kind of thing. And then we've also gone into several states on a more intense level to work with trying to develop a strategic plan, or to work with the organizations that are there to either get them to in some way come under a unified umbrella, or to kind of become Medicaid providers. I mean, it runs an entire gamut based on where they're at. And I just wanted to add a kind of one more thing to the previous discussion about, how do you start this whole process? And that's to always keep in mind what will families and youth get out of this experience. I often say you're not going to get families to come and participate if they don't feel like they're going to walk away with information, resources that's going to help their child or other families that they know. I've often said that if you want families to come out, then you have a forum around education or special education. That is a sure way to get families to come. And then you listen and you provide resources for them, and that's how you're going to get them to come back. So just always keep in mind, you want them on your committee, but they have to feel like they're getting something as well. So.
Great,
Okay,
Jane.
Denise.
Thank you so much. That was a great way to end today. We want to thank you for joining us this afternoon. We are answering Tania's question now, and it's up there. The best way to learn about all of these different learning opportunities is to subscribe to the TA Telegram. And we will also be sending out the link to this recording to everybody who registered. You will be receiving an email from me probably early next week. We're also going to put the files up on the screen. We're going to leave the screen up for 10 minutes so that you may download these resources, and you'll be able to access the resources through the recording link that I send out as well. Again, please think about joining us next, or in April, not next month, for the learning community on financing plans. And please send us your suggestions on topics you'd like us to cover in future learning community meetings. Thanks again, and have a wonderful afternoon.